Welcome and thank you for joining today's conference. Before we begin, please ensure you've opened the WebEx participant and chat panels by using the associated icons located at the bottom of your screen. Note that all audio connections are muted at this time. If you require technical assistance, please send a chat to the event producer. With that, I'll go ahead and turn the conference over to Cheryl Levine.
Hello, good afternoon. This is Cheryl Levine. Thank you for joining our webinar. We're focusing on telehealth for community-based organizations. And our webinar today is on best practices for accessibility and language access. Okay, so welcome back. This is our second webinar series, and I am Cheryl Levine with HHS. I am the lead for our at-risk individuals program with the Office of the Assistant Secretary for Preparedness and Response. Thank you to HUD for being our co-sponsor in this webinar series. Benjamin DiMarzo is the Assistant Deputy Secretary for Field Policy and Management with the U.S. Department of Housing and Urban Development. And my other partner for this web series is Liz Galena Hall. She is the Long-Term and Post-Acute Care Coordinator with the Office of the National Coordinator for Health Information Technology, or ONC as we call it, with HHS. And with that, I'll hand it over to Ben for some opening remarks.
Thank you so much, Cheryl. I appreciate it. Thank you, everyone, for joining today's call. My name is Ben DiMarzo. I'm the Assistant Deputy Secretary here at HUD for our Office of Field Policy and Management, which oversees our place-based programs, which includes the Envision Center demonstration and Promise Zones, and also our efforts on Opportunity Zones. So as I said on the last call with all of you, health and wellness services were the #1 request that we saw from Envision Center sites and local community partners. So we really appreciate HHS assisting us in putting together this seminar for everybody. I know a lot of you are now dealing with the dual reality of a pandemic and a hurricane hitting the Gulf Coast. So now more than ever, people need remote mobile access to health services. And we really appreciate everything everyone on this call is doing as the first line of support for people who are the most in need in our country. So I'm going to keep it short today because we have a lot to get through in this presentation, a lot of important services and information. So I just want to say on behalf of Secretary Carson, I want to thank everyone for everything you're doing during these difficult times. And we know that the people you serve are very appreciative of your efforts. So Cheryl, I want to turn it back over to you to start today's presentation.
Thank you, Ben. Thanks for joining us today. So again, this is a webinar series. This is part 2 of a 3-part webinar series. And we, again, are so appreciative to HUD for helping us to host this. For our webinar today, we will use the chat box for questions. So if you have questions of the speakers, go ahead and enter them in the chat box, and we'll address those at the end of the webinar. We are recording the webinar, and we'll be able to post it for you to be able to receive those resources at a later date. We did have an earlier webinar. A month ago, we had a focus on services, payment, and partners, Telehealth 101, and those resources are now available on our webpage at HHS ASPR, including the recorded webinar, the transcript, and the Q&A from the audience. So just to kick us off, a little background on addressing accessibility and language access in emergencies. There is a series of federal laws, executive orders, and various national guidance that provide sort of the backbone of describing equitable access, requirements for equitable access to programs and services. Some of these federal requirements are specific to disasters and public health emergencies, but others apply more broadly to preventing discrimination against at-risk individuals with access and functional needs. And I wanted to highlight a couple of those executive orders that I think help frame our discussion for today. First, Executive Order 13347, Individuals with Disabilities and Emergency Preparedness from 2004. This executive order requires that federal governments appropriately support the safety and security of people with disabilities in all types of emergency situations through a coordinated effort. This includes considerations for the unique needs of people, employees of the agency and their disabilities, as well as others they serve. Encouraging consideration of the unique needs of employees and people with disabilities served by state, local, tribal government organizations and private organizations in emergency preparedness planning, and facilitating cooperation among federal, state, local, tribal, and territorial governments, as well as private organizations. The other executive order I wanted to mention is 13166 from 2000. In fact, we're this month celebrating the 20th anniversary of an executive order on improving access to services for people with limited English proficiency. And under this executive order, the federal government committed itself to two goals. First is to identify, develop, implement policies that will ensure that individuals with limited English proficiency, or LEP, have meaningful access to federal programs and activities. And the second goal is to provide guidance to help recipients of federal financial assistance understand and comply with their obligations to overcome language barriers in compliance with the national origin non-discrimination provision of Title VI of the Civil Rights Act of 1964. And just as a helpful tool that I think can emphasize some of those requirements, we do have an HHS Ask for Fact sheet on communication access that provides some promising practices and resources for addressing effective communication in emergencies. And with that, I'm going to turn it over to Liz and have her introduce our speakers.
Thank you, Cheryl. So we have, as mentioned, an exciting agenda for you today. First, we are going to hear about assistive technology and accessible telehealth. Specifically, we'll learn about the state assistive technology program, what is assistive technology, how it can be leveraged with telehealth, and some success stories. Next, we'll hear about telehealth and culturally and linguistically appropriate services that can help improve quality of care for patients and advance health equity. And finally, we'll be hearing about promising practices for addressing social isolation and loneliness among adults in senior housing through the work of the AARP Foundation Connected Communities that are providing really innovative solutions to address some of these challenges during the pandemic. And with that, I will introduce our speakers today. First, we will hear from Brian Norton. Brian is the Director of Assistive Technology at Easter Seals Crossroads. He is responsible for the agency's assistive technology services that include clinical assistive technology and the In-Data Project, a federally funded statewide assistive technology program for the agency. Next, we'll hear from Kathy Witherly. Kathy is the Director of the Mid-Atlantic Telehealth Resource Center, one of the 12 regional telehealth resource centers serving the country. The telehealth resource centers are federally funded to assist with telehealth programs, development, and sustainability in order to increase access to quality care for rural and other underserved populations. And last, we'll hear from Ryan Elza. Ryan is a social entrepreneur in residence for social connectedness at AARP Foundation and leads the AARP Foundation's social isolation and digital inclusion work. He has an extensive background in social determinants of health, design thinking, and civic engagement. And with that, I'm going to turn it over to Brian.
Excellent. Thank you, Liz. Again, yeah, my name is Brian Norton. Super excited to be here today with you. Let me move over my slide. There we go. Super excited to be here with you today. I'm going to be going over, as Liz mentioned, several different things, just providing some information about state AT programs and the services we provide, kind of level setting everybody on what assistive technology is and why it's important. Talk about what to consider when choosing online meeting tools or telehealth tools. Discuss some common accessibility features found in those tools, and then talk about some resources and some success stories. So let's go ahead and just jump in. So state AT programs funded through HHS and ACL. There are 56 state assistive technology programs. There's one in every state and every territory. And these are great resources for accessibility and assistive technology for you and your consumers or clients. Really, state AT programs have two main goals. One is awareness, making sure that people know about assistive technology, how it works, and where they can get their hands on it. And the second is really about acquisition, getting people's hands actually on the assistive technology. We do that in a variety of different ways. Those are listed there. Device demonstrations help people become familiar with assistive technology by comparing and contrasting different devices and tools. Device loans allow people to borrow assistive technology for short periods of time to really try something before they purchase it. Device reuse We receive assistive technology that's no longer used or needed by its original owner, and then we help connect those devices to other persons in need. And then we also offer state financing, which helps people acquire their own assistive technology if they're not connected with a funding source. So just to level set everyone on what assistive technology is and why it's important, there are a lot of technical definitions, more technical than the one I have on your screen, but this is how I kind of explain it to folks. It's really any device or system that helps someone do something they wouldn't otherwise be able to do. And so while we're here, I'll just mention assistive technology is one thing, accessibility is another. Accessibility really is kind of more about the usability of a tool, whereas assistive technology is a device that provides access to something. And so, although they might have the right tools to be able to access telehealth, like a keyboard or a mouse or a large monitor or other kinds of things like that, it really comes down to the usability or the accessibility of that tool to whether they can access that well or not. And so there's some nuances there between accessibility and assistive technology. Really the purpose behind assistive technology, or how I view assistive technology, obviously increase the efficiency or effectiveness of a person and the task that they're doing. It decreases the degenerative nature of a disability, helps people avoid injury, but ultimately I think it all rests on we want people to be independent. We want people to be as independent as they can in all areas and all walks of their life. And so assistive technology can become a really important tool for folks. Comes in all different shapes and sizes. You'll hear it referred to as low, mid, or high tech, lots of different cost ranges. Sometimes it doesn't cost anything, sometimes it can cost a lot. Got a range of different devices there on your screen. One is a braille panel at the very top there. Those can be really expensive, but it allows a person who is blind or visually impaired a way to be able to get tactile feedback from the computer, all the way down to either maybe using a large print monitor or some other device, an adaptive keyboard or pointing device to be able to get access to a computer. Again, all different shapes and sizes, lots of different things to be able to look at and try. And that's where the state AT programs come in. They have libraries, as we mentioned before, where people can borrow equipment to really better understand what's out there and what they can use. I do think it's important with assistive technology to recognize that one size doesn't fit all, that disability affects everyone a little bit differently, and that really our choices with what we want to use to be able to access different things will be based upon a lot of times our experiences, what our preferences are, and what our tolerances are for the types of technology that are before us. And so what people use can vary greatly from one person to the next. So online meeting platforms or telehealth tools, there's lots of choices, especially nowadays. It seems like there have been hundreds that have popped up that maybe no one's ever heard of 6 months ago. And so there's lots to choose. So what do you need to consider when you choose an online meeting tool? Well, I think for most of us, choosing an online meeting tool really matches the process for choosing any other technology. We often look at the tools and features of a product and decide if that's the right fit for what our need is. One thing that I think is really important for community-based organizations and people to think through is to be able to think through the importance of accessibility from the onset of that decision-making. Although it might have the right tools and the right features, I really think we need to think about accessibility as a part of that initial look at what we're looking for. And so build that accessibility and the importance of that into your process for selecting tools. A lot of times technology or these online meeting platforms can be simple or complex. And really, depending on what you're doing, if it's just a face-to-face meeting or a conversation, you may choose a completely different tool than if you have to share a document or conduct a webinar like we're doing today. Often what we are going to be doing within these meetings will often drive the tools that we choose. There are always a lot of different features available. It's becoming familiar with those different features. Again, this would lead into how you're interacting with your consumers, with your clients. And so common features found in online meeting tools include video, face-to-face conversations, recording, screen sharing, remote control, security. And again, goes back to what type of meeting are you facilitating? And what types of tools will you need to be able to make that go well? As I said, always think about assistive technology or accessibility at the beginning. As you start looking at tools, there's a couple of things to be able to look for when you talk to companies about their tool and what they provide. There is something called a VPAT, or a Voluntary Product Accessibility Template. This is a document that explains how information and communication technology products, such as software, hardware, content, support documentation, and much more, conform to the revised 508 standards for IT accessibility. You'll also find that a lot of companies, Zoom, Teams, other products, they also have an accessibility help desk, which specifically allow folks that use assistive technology to call in and get their accessibility questions answered. And so a couple of tools to be able to think through there. So let's talk a little bit about the various accessibility options and features available in many of today's tools. Many tools like Zoom, Google Duo, Meetings, Microsoft Teams provide automatic subtitles and captioning. So a lot of tools are starting to use artificial intelligence to provide automatic captioning to those, to whatever meeting that you conduct. You can also have live captioning. You'll often find in the toolbar in many tools a CC button to be able to turn captions on. It's an important note that live captions have proven to have higher accuracy rates than some of the artificial intelligence ones, and that's because you actually have a person listening in and typing the captions, and it provides oftentimes a little bit better context and information and just a higher accuracy rate when listening to those. Other things to consider, just the ways and the modalities that people get access to the meetings. A lot of tools will provide computer audio and or phone-based audio, so that if you're working with folks who don't have a tablet, don't have a smartphone, don't have a piece of technology that can allow them to get access to tools or to your meeting, making sure that there's a phone base where they can just pick up their landline and call in to be able to listen in. If you're using audio, think about a headset or noise-canceling headsets to be able to, help limit the background noise in meetings. Always consider keyboard accessibility. That's super important for folks who are visually impaired, so that if they're trying to click on something or find a button or a function or words on the screen, a lot of tools will allow keyboard functionality, so you can just press the keystroke to jump to different areas like the chat room or the participant list or other types of things. High contrast is also a feature in a lot of different programs, specifically for folks who have difficulty with vision. Again, being able to see the words on the screen a little bit easier. You can change it from black text on a white background to a little bit more high contrast where you've got white text on a black background. So high contrast settings are also a part of those tools. Other things, adjustable fonts. You'll find that a lot of programs offer adjustable fonts. I would always consider lighting, whether you're a presenter or the participant, making sure that you have proper lighting so that they can see your face. If a person reads lips and can't see you, that can be very difficult for folks. Rule of thumb for that is always have the lighting in front of you, not from behind, because that's going to cast shadows and make it more difficult to see you. Always provide accessible content beforehand. So if you're going to be passing around a PowerPoint or handouts or slides or those types of things, make sure that's available for folks before the meeting so that they can review them and take notes on those. Another thing that we have found really useful for the folks that we serve when we're doing telehealth or online meetings with them is a way for them to think about positioning a tablet or a smartphone. Oftentimes holding it for a person with a disability can get challenging. You're not being able to see them very well. They have to adjust and do those types of things. And so thinking about some way to mount or position whatever device they're using in a way that they can be able to better participate in the meeting and be there with you. A couple of end user things, and I'll kind of briefly just run through these. Prep your technology as an end user, things to coach your clients and consumers on. Hopefully they can prep their technology to know what's being used by the provider. If you need an accommodation as a participant, ask for it, request it. Consider getting on early, doing test runs. Make sure that, again, with that positioning, looking at how are you going to position your technology, your phone or tablet. Make sure that your technology is charged. Your phone's charged, your computer's charged. You don't want that to go off in the middle of your meeting. Prep your environment. Go to a quiet room. Sometimes that's harder than we might want to realize. Test your audio connection. Prepare your assistive technology. Make sure it's ready to go. Again, accommodation requests. Sometimes even having someone there to be helpful in your telehealth visit can be helpful, to be able to take down information and write notes. And so lots of things from an end user perspective as well. And then really, just to note a couple of success stories. The first one I'll just mention is Eli. Eli is a 3-year-old. He has cerebral palsy with developmental delays. Currently, because of the pandemic, he's at home receiving OT, PT, and speech therapy through Zoom with his OT, PT, and speech therapist. And what they have done is the parents have described to me, it's taken the partnership in that therapy to a whole new level for them. It's allowed them to be able to be hands-on and participatory in that therapy, which has just helped them once they're done and out of the therapy session with their therapist. They are able to then take that and kind of work what they've learned from the therapist into their daily routine and rhythm of life. One unique thing that their therapist has done is use visual aids as a part of their therapy. And so what they end up doing is taking a doll, and when they need to move the arm in a certain direction, they take that doll and they help show them how to move it so that they can kind of better understand what they're doing with that. And so just a great way and a great story about how telehealth has really improved access and created a real partnership between people. Another person is Cindy. Cindy's got a dual sensory loss, was being seen for a communication assessment. She has low vision and she's hard of hearing. They used the Wavelo app, which is a free iOS and Android app, and it provided 3-way conversation between her, our person, our technologist, and their interpreter to be able to have conversations. And what was really great, it was familiar technology to this person and to the other folks that were in the meeting, and it really expedited the service. We didn't have to wait until it was the proper time to go visit her, and we were able to expedite things with her. And so just a couple of ways that telehealth has kind of helped folks in the current situation that we find ourselves in, either with a different way to receive services or with expediting services as well. I'll kind of leave you with a couple of links, and these will be, I'm sure, in the PowerPoint that you can get, but just ways to connect with your local state AT program or with Rob Grenendahl, who is with ACL, to learn more about state AT programs and the things that they offer. And then again, additional resources and information about other telehealth resources with regard to accessibility. And I'm going to pass this off to Kathy, and so let's see if I can do that. There we go.
Oh, great, thank you. And I am going to basically give the level setting for the culturally and linguistically appropriate services standards related to language and communication services. So big picture-wise, the class standards are intended to advance health equity, improve quality, and help eliminate a lot of the healthcare disparities that many of you who are working in the field see every day on an ongoing basis. And so the principal standard really is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to the whole diversity of health beliefs, practices, languages, literacy, communication needs. But what we're going to focus on right now are standards 5 through 8, which are the communication and language assistance standards. And I would basically say that this is the gold standard for communication and language assistance. And so we know, and federal government knows, that not everyone can meet these standards, but we're holding the bar high and hoping that we can rise to this. So Standard 5 is offer language assistance to individuals who have limited English proficiency and or other communication needs at no cost to them to facilitate timely access to all healthcare services. Standard 6 is to inform all individuals of the availability of language assistance services clearly and in their preferred language, verbally and in writing. 7 is to ensure the competence of individuals providing language assistance recognizing that the use of untrained individuals and or minors as interpreters should be avoided. And then 8 would be provide easy-to-understand print and multimedia materials and signage in the languages commonly used by the populations in the service area. And we all know that that does not always happen, and sometimes in some places it rarely happens. But basically what the Office of Civil Rights looks at is for any recipient of federal financial assistance from Health and Human Services, they're expected to take reasonable steps to provide meaningful access to LEP persons. And so what does reasonable and what does meaningful mean? Well, they did provide a little bit of a guidance around that. So to assess whether something is reasonable and meaningful, it's based on the number or proportion of LEP persons eligible to be served. So for example, if you live and your clinic or healthcare clinic is in a neighborhood that is just, 50% Latino or 80%, refugees from whatever country, you know that your population, your patient base is going to be significant in the number and proportion. And so in those situations, the expectation is higher that you would be able to serve that population with language access services. So again, the frequency with which LEP individuals come into contact with the program, the nature and importance of the program activity or service being provided, and then the resources available. So again, we always look at, is this someone who can actually have the resources? So if you are a large hospital health system and you have a huge endowment and you're working with, a population that needs language access, you're going to be expected to provide language access services free of charge. But if you are, let's say, a small free clinic and you, are basically working on a shoestring and are scraping bottom just to keep the doors open, that meaningful and reasonable criteria is obviously held a little bit differently for you. So let's talk a little bit then about your role in terms of helping a patient or client navigate, because we all know with this pandemic, people are flipping to telehealth, both for access to care, but also for avoiding exposure. And so clinicians are doing the same thing. They don't want to be exposed to COVID-19, and people and family members, patients don't want to be exposed. So then how do we then deal with patients who have language and communication needs? So some things to really consider as you're helping these individuals are, does my client require language assistance? That's really the first question that you need to ask. And it seems basic, but it's not always that basic. So sometimes bilingual individuals or people who are just learning English, they may actually speak pretty well in terms of everyday conversation. They can go to a restaurant and order a meal, or they can, have a conversation in the street and ask for directions. But does this client know and understand healthcare terminology? So think about your average, let's say, 8-year-old or 10-year-old. How much terminology in terms of healthcare and medical and anatomy and physiology do they understand? Because if you're thinking about someone who's learning English as a second language, that is usually not the terminology they are receiving in their ESL classes. So as you think about, does my client require language assistance, also take it the next step further. Does my client understand basic medical and healthcare terminology in their repertoire of English? If they do require language assistance, is it just language assistance, or is there a need for a cultural broker? And what does that mean? It means that oftentimes people coming into this country do not know or understand the cultural context in healthcare. They also don't understand the infrastructure in healthcare. And so if you're coming from a country where healthcare is free, where it's universal healthcare, and you basically, feel like if you get healthcare, you just get healthcare, you just go to wherever you go, you can show up in the emergency room or you can go to a private office, there's going to be some cultural navigation in terms of helping them to understand, everything from third-party payment, Medicare, Medicaid, navigating all of that, all the way to the cultural context of, somatic symptoms and how you describe symptoms. So I am actually from an Asian culture, even though I grew up in the United States. And in Asian cultures, it's often, it's much more acceptable to describe things from a somatic point of view as opposed to, let's say, a mental health or emotional point of view. So if I'm having emotional problems, I may say I have, frequency of stomach aches and headaches. And for a provider who may not be aware of that cultural context, it often is very helpful to have a cultural broker basically be able to navigate that. So think about that in that context as well. So you also need to think about what resources are available to you or them, and are these resources available on-site or remote? So the obvious gold standard is you have a trained healthcare interpreter and you have access to that person. Many times that is not possible or feasible, so then you think down the list. So are there some bilingual healthcare workers that I might be able to bring into this situation? If the answer is no, is there bilingual staff that might be non-healthcare staff, but let's say, it could be the person who is the receptionist answering the phone, or it could be, someone who's in the daycare center who's bilingual. Then you can really think about, if none of those are options, are there some bilingual friends or family members? And often this is not advisable because of privacy and just contextual pieces of healthcare. So, oftentimes you don't want to ask a patient sensitive information if they have a friend or family, and, like if you're asking them about sexual health. Oftentimes people are uncomfortable answering those questions in front of a friend or family member, and certainly not with a minor child trying to be the interpreter. So I think those put you in very awkward situations where you may or may not then get useful healthcare information. So some other things to really consider are, does my client's cultural beliefs impact their acceptance of technology? And this is going to be an interesting one because there are definitely cultural beliefs around technology. Some cultures are very embracing and accepting of technology, but there are also some cultures, and I'm even thinking about U.S. cultures, like some of the Appalachian cultures, where technology is suspect. It's part of big government. They're listening in on me. And so you really need to see if you can understand and get a hold of, what are those beliefs around technology. Will my client be able to provide consent for telehealth services without an interpreter or translated consent materials? And this is a really important piece because many times states or even funder requirements require a consent for telehealth services. Some of these things have been more relaxed as a result of COVID, but at some point COVID will be over and we may still have to go back to, requiring that written or at least verbal consent. And so is that consent form going to be available in that person's native language? And if not, are they going to need an interpreter to be able to explain what they're consenting to, because it's no longer informed consent if they can't understand it. Then you need to really ask, what device will my client be using to connect with his or her healthcare provider, and that should say how many video and or audio connections are possible or feasible. So what you'll need if you're bringing in an interpreter is a multi-point connection unless the interpreter is there with the client or patient. And so if you're bringing in someone, let's say a bilingual staff person or bilingual family member, and they are not there with the patient or client, they're going to need to be able to connect to whatever is happening with the provider and the patient. So what can you do to assist? One is to make sure that the provider knows that your client or patient will need language and or cultural broker assistance, and that you and the provider know exactly what language or dialect is needed. And this is very important, particularly in languages where there are multiple dialects and regional variations, Spanish being one of them. So oftentimes you just say, I have a Spanish speaker. Well, great, but are they from Spain? Are they from Colombia? Where are they from? Because even something as simple as the word for, let's say, baby bottle, that can vary significantly from region to region. And so when you are using healthcare interpretation and you may be talking about a baby, there are going to be some issues with the word-for-word translation, even if you're saying, my client knows Spanish. So we really need to kind of think through the language and then the dialect. Find out what language access options the provider might have available. And also do all these things in advance of the visit as much as possible. So find out what platform the provider is using. Will the technology allow multi-point video connections or have integration of healthcare interpreter services? And if not, find out if the provider would be willing to use one that does. And some of you are acquiring technologies to assist with other things. Brian did a great job of talking you through some of the technology things to consider, so I'm not going to go through all of that. But it's really very much the same thought process in terms of what platform do you use and what can you do. So assess the best workable options and alternatives. So video interpretation is by far better than just audio only, and we all know, I think, that the vast majority of communication comes from body language, from nonverbal, and so the more that the interpreter can see what's going on with both the patient and the provider, the better the contextual of interpretation will be. Some telehealth platforms integrate healthcare interpretation services as part of their license agreement, and we're seeing more and more of this happen. We've seen several major companies add interpretation just during the pandemic because they're realizing that this is really important. And so don't be afraid to ask the healthcare provider, do you already have this service? Can you enable it? Because this is what's needed. We know many of you are using Zoom, because Zoom for Healthcare has a feature for designating interpreters. So if you have an interpreter, this is the web link for how you designate someone as an interpreter in a three-way or multi-way video conference. And that is a nice feature to be able to use. So a trained healthcare, and I already said this once, but a trained healthcare interpreter will almost always be better than using staff, family, or friends because, one, they're trained in medical terminology, they're trained in best practices in terms of interpretation. But there are some remote interpretation companies that will come in using video. So Stratus Video, In Demand Interpreting, Language Line Solutions, they all have video-based language interpretation. Make sure you ask for a healthcare interpreter if you are going to be using those services because oftentimes some of these people are trained in, let's say, legal interpretation or other contexts of interpretation, and healthcare definitely has a different set of terminology. Do not use Google Translate for healthcare interpretation, and this is just a big red flag warning because Google Translate is used a lot for kind of everyday conversation. The Google Translate, they've done some studies on it, and it's only about 57% accuracy when used for medical phrase translation. So that's not what it's built for, it's not what it's designed for, and so just urge caution in using things like that. If you have no other options, can't reschedule the visit, it has to be that time, that day, you don't have an interpreter, you don't have anyone on hand. A somewhat better option is instant language assistant software or app that's being made available free during the pandemic, and you can download that. But again, using an app for interpretation is really not your best choice, and so that really is kind of your last resort. These are a number of useful resources and links in terms of where you can go to the National Board of Certification for Medical Interpreters. If you have bilingual folks on your staff that you think might make good medical interpreters for your patients or clients or people that you serve, it might not hurt to get them certified as a medical interpreter. National Council on Interpreting in Healthcare, state law requirements addressing language needs in healthcare, a guide to understanding, interpreting, and translation in healthcare, and practice guide to implementing the national class standards. Those are all very useful resources that you can draw on. And last but not least, I am part of a regional telehealth resource centers, and the telehealth resource centers are federally funded. Our services are free of charge, and we're really here to help you and healthcare providers know how to use technology better in order to deliver healthcare and deliver better access to healthcare. So you can reach out to us. Our website is telehealthresourcecenters.org, so it's very easy. And from there, you can reach out to any of the regional resource centers that serve a state. And my states are the dark purple states on that map. And this is my contact information, and I'm happy to take emails or requests if you are in my region, or if you're not in my region and you email me, I will direct you to the telehealth resource center that serves where you are. And so that is what I have, and I will pass the ball to Ryan.
Thanks so much, Kathy. Hi, everyone. As mentioned, I'm Ryan Elzo, Social Entrepreneur Resident at AARP Foundation. So those of you who may not be as familiar with AARP Foundation as our famous sister organization, we are the charitable affiliate of AARP, and we serve members and non-members alike around two main pillars to end senior poverty. So that's building economic opportunity and social connectedness. And so today I'm going to talk about our work to promote digital equity within affordable housing by working with providers of multifamily in order to make sure that residents have access to broadband, hardware and devices, and the wraparound training and support in order to use those devices to promote social connection, and also how they can use it to maintain their independence and age in place. So at AARP Foundation, when we talk about social connection, we really think of two constructs. We think of social isolation, which is the quantifiable measurement of an individual social network size and the frequency of engagement with individuals within their network, the availability of transportation, and their ability to access resources and information. We also think about loneliness. So loneliness is actually how individuals perceive their experience and whether or not they feel isolated. So social isolation is a health issue, and it's equivalent to smoking 15 cigarettes a day, which is pretty significant when you think about the frequency and prevalence of social isolation in older adults and people with disabilities, especially now during a global pandemic in which most of us are forced to socially distance and don't have the ability to connect in person in a way that we did previously. And so social isolation is associated with increased higher blood pressure, increased susceptibility to flu, greater risk of heart disease, and early onset of dementia. And all of these health impacts add up. So older adults who describe themselves as lonely face a 59% greater risk of functional decline, a 45% greater risk of death, and also an increased cost with Medicare, about $1,600 per individual, which equates to $6.7 billion annually. So it's really important to understand social isolation and connection as you think of addressing it, and specifically within the populations that you're serving. So social isolation is often the confluence of many different risk factors at the societal, community, and individual levels. And so when we think about residents within affordable senior housing, we see that these risk factors are often happen at higher rates. And so residents often frequently have lower incomes, less social support, and worse health compared to those who continue to live on their own in their community. And we know that social isolation prior to the pandemic affected about 1 in 4 older adults in senior housing, and that nearly 70% of adults in senior housing reported some feelings of loneliness, which is pretty startling. So at AARP Foundation, when we're trying to develop new programs and services to address root cause issues, we really look at a human-centered design approach about how we can develop solutions for individuals. And so we follow a 3-step process that we have built out within our AARP Foundation Connect to Affect Connected Communities program. So first, we really start with assessment and awareness. So we take a person-centered holistic assessment of individuals related to their condition of social connection and isolation and technology needs and their interests, then kind of identify what are the barriers impacting individuals and their ability to access technology, such as access to broadband and affordability. And then, from a public health perspective, how can we increase awareness about social isolation and loneliness and the importance and opportunity for social connection? Then we work with organizations in order to facilitate the connection to broadband technology and training. And, we have worked successfully with multifamily providers and most recently to leverage reserve funds in order to complete infrastructure upgrades within their communities to make broadband more accessible within their communities and provide opportunities for synchronous and asynchronous classes and education. And then also provide toolkits for organizations to think about how they adapt their current programming from in-person engagements to virtual engagements during COVID-19 to make sure that there are safe interactions between residents and staff and the community. So AARP Foundation's Connected Community, was the result of a rigorous research and extensive, look at how we could leverage the power of voice-first technology to promote social connection within affordable housing. So we work with providers to first understand how they can make sure that broadband access is available to every resident. We then help them identify what type of technology might have the most meaningful impact within their communities and how they can safely distribute that technology to every resident, and provide wraparound training and support for both staff and residents and education and curriculum about how they can use the technology for social connection. And then we've also built our own AARP Foundation voice-first applications available on Amazon Alexa and Google Home. And so one of those applications is called Community Hub, and it's a system that allows resident services staff within affordable housing communities to be able to interact and engage with residents, and makes information available to residents on demand through their Amazon Alexa or Google Home smart speaker. And so it essentially turns Amazon Alexa into a concierge for senior living and provides providers with the tools to be able to interact and engage with their residents directly in their home in a safe and meaningful way. And so there's a couple of different steps to how we have created an out-of-the-box experience. The original program design relied heavily on creating in-person engagements and training for both staff and residents, and we have since pivoted all of our training into a train-the-trainer model that is available through remote training that allows organizations to really think about how they do it in a sustainable and cost-effective way. So we provide training to staff and volunteers. We have a facilitator guide to accompany those trainings. We've created remote workshops and presentations that also have guided recorded trainings that organizations can deliver to their residents in small group settings. And then we have explainer videos that also accompany that curriculum. And most recently, we've been working to develop a Telehealth 101 curriculum for residents that really focuses on that consumer education for residents to understand what is telehealth, how can they access it, how can they prepare for their visit, and what questions do they need to be asking their providers. And the reason why we have now ventured into this telehealth consumer education space is immediately when the country started closing down, we heard from numerous providers stories of residents within affordable housing who were foregoing their regular doctor's appointments and health care due to concerns and fears of COVID-19 transmission. And so it really was brought to our attention as an acute pain point and need that exists out in the community. And we have since developed a training curriculum to help try to support organizations as they try to support their residents during this time. And also we have course handouts. So technology offers a equitable access to not just the internet and information, but also calling and messaging, accessing essentials such as online grocery ordering, or especially now, making sure that people are able to order and get their medications delivered to their home, exercise and wellness, information and resources, online communities and opportunities for education, news, virtual volunteering, really trying to maintain purpose during this time when many of the in-person interactions and engagements that we used to participate in are no longer safe to do so, entertainment and game, books, and as mentioned, telehealth. So as a part of our response to COVID-19, we've actually been expanding our programmatic model to be inclusive of different types of technology. The original model really focused on smart speakers because the original research that we did within affordable housing was that voice assistance and natural language processing really provided a much easier to use interface for older adults, and it was less intimidating. And it was actually providing companionship anecdotally from individuals. We've since expanded into working with 4G LTE enabled tablets. So in trying to respond quickly, it's not always possible to upgrade an individual property's infrastructure in order to have broadband accessible. So we have been working with companies to make sure that if that is not an option, that any device that is sent out has those data capabilities in order to access other types of softwares and services. And we've also been working to deploy smartphones And at the core of all of these devices, making sure that the voice-assisted capabilities of these devices is really first and foremost, presented to residents, since it, from our experience, provides one of the easiest to use interfaces. And so I'm going to share just a couple stories of one of our most recent bulk deployments that we did in collaboration with Mercy Housing. So there are some amazing stories about how residents have been using the 4G LTE tablets that have been recently deployed. We've approximately deployed about 800 devices with the goal of 1,000 devices across 90 of their properties. And so residents are using it to connect to faith. So now that residents are unable to gather at churches or their place of worship, we have residents who are participating in Bible study and services through virtual experiences. We have residents who are connecting to their neighbors, so service coordinators who have adapted their programming to create remote engagement experiences available through Zoom. We have residents who are connecting globally, so residents who haven't been able to see their family members who live across the globe, being able to do video conferencing to talk with them. And then residents who are connecting to services. So one resident who had major abdominal surgery earlier this year used the tablet to video chat with her family back east and finalize her travel plans to visit them. And she used the tablet to complete all the paperwork for her new driver's license and real ID so that she didn't have to go into the DMV and wait in all those long lines that we all appreciate so much. And then residents are also using the devices to connect to resources. So the ability to access services through their local library, to read books, interact and engage with friends and family, and play games with them as well, and then also connecting to wellness. So those residents who participated in different types of physical activity classes are now able to practice within the safety of their own home those same routines that they were accustomed to doing. And so in this picture here, we had one resident who now attends her regular Monday yoga class using the tablet and the video conferencing. And so with that, I'm actually going to hand it back over to Cheryl, and we're going to go into question and answer period.
Thank you, Ryan. Thank you to all our presenters. I think that was a lot of really outstanding information. And so we're going to open it up to a few questions. If you do have a question and you'd like to include that in the chat, please go ahead and do that now. I'm going to go back up. We had a few questions early on, so I'm going to go back to Brian and ask if Brian Norton can answer a couple questions. First of all, do you know, we had a question, does the U.S. Virgin Islands have their own assistive technology program? You mentioned the states have their AT programs. Do the territories also have their own AT provider?
Yes, the answer is yes to that. So all states and all territories do. So Virgin Islands does have a state AT program.
Great. We'll make sure we share that with everyone, how to find those AT programs. And then finally, for you, Brian, one more question. How does someone that does not have internet access use assistive technology? Are those complementary, or is there a challenge there?
Yeah, well, I mean, assistive technology, again, comes in all shapes and sizes. It doesn't necessarily rely on, some things don't necessarily rely on internet access, but if you are using something that requires internet access, you know, there are options or there are some considerations and things to look into. I know here in Indiana, where I'm located, we have a broadband map of where broadband access is, and we work very closely with providers like Comcast and AT&T. They have low-cost internet options for folks who have difficulty with funding. So Comcast Essentials is an example of that, where it's $9.99 a month. And during this pandemic, I believe they've suspended payments on those through the end of the year and have given some grace to folks just to be able to give them access that they need. It is a challenge. We have a lot of rural areas in America, and broadband and internet access isn't readily available for a lot of folks, and so that's a challenge. And so it really kind of depends on individual situations and what they're trying to use and access.
Thanks, Brian. Brian. Liz, did you want to handle a question for Kathy?
Absolutely, yeah. So Kathy, we had a comment in the chat about certification for the medical interpreters. And the comment was, there are 2 national certification bodies in the U.S. The Certification Commission for Healthcare Interpreters, CCHI, is noted as being preferred as they are accredited by the NCCA. And the national board lost its accreditation several years ago. So I wondered if you were able to just make a few more comments on certification.
Yeah, so I think there are some national certifications, but there are also some local certification bodies that are under these national bodies. And quite frankly, I would say the certification bodies provide kind of the standards for what should be trained, and they provide kind of the training, the core curriculum in terms of training. But most of that training takes place at local or regional levels. And so from my perspective, and just from hearing from other people, it really doesn't make a whole lot of difference which certification body is used, but really thinking about the training standards and that person gets trained. Did that answer the question?
Yep, thank you.
Thanks, Kathy. And then I have a couple questions for Ryan. What do you recommend for making virtual presentations about Medicare benefits more engaging for seniors? We have a listener who says our organization does presentations to educate seniors, but they've now shifted to more visual presentations because of COVID. Do you have ideas for making things more engaging?
Yeah, absolutely. Thank you for the question. I think in terms of best practices for delivering education to older adults is making sure that the information is in manageable bite-sized chunks, and the more visuals you can provide is really effective. And then also providing any opportunity for engagement and interaction is always helpful in kind of reinforcing the content and addressing the needs of the community.
Thanks, Ryan. And then another question, folks are interested how they might get a tablet from AARP, and what does it take to get those tablets to older adults? Sort of what is the lead time for training and getting those into use?
Yeah, great question. So folks are welcome to visit our website for Connected Communities, which is connectedcommunities.arpfoundation.org. And there is a contact us form there, and so individuals can submit their request to kind of learn more about our current programmatic offerings. To date, we've been primarily working with providers of affordable housing and multifamily to make technology accessible to older adults. And the lead time for being able to deploy those tablets, it's actually a pretty quick turnaround now that we've kind of built out the content, so it could be done within a couple of weeks after all the paperwork and signing and information is completed.
Okay, well, we have a few more questions, and I think we'll be able to respond to those later, probably on paper, but I did want to make sure folks know that, apologies, we did not have this captioned in real time for you. We will have a transcript and the recorded webinar available for you at a later date. We will be able to share the PowerPoint slides and all the information, including the links to the resources that were shared, to you at a later date. And for folks who are looking to find the resources for the first webinar, that is all up and available. I have listed here our Telehealth 101 Services, Payment, and Partners webpage where you can access the resources for that first webinar. Likewise, we'll get everything up in one place for you for the webinar on accessibility and language access. And then mark your calendars. We have one more webinar in our series coming up on addressing barriers, thinking about the needs of individuals experiencing homelessness and connectivity. So that will be in a month on September 30th. And so with that, thank you everyone for joining us today.
All right, that will conclude our conference. Thank you for using AT&T Event Conferencing Enhanced. You may now disconnect.